Hi, good afternoon, and welcome to episode 10 of the CNAR TV 2025. From solo acts to supergroup, the amalgamation experience. My name is Jacquie Messer-Lepage, and I'm with the Saskatchewan College of Paramedics. I'm the executive director and registrar, and I have with me two experts in the area. I have Dianne Millette, registrar and CEO of the College of Health and Care Professionals of British Columbia, and Louise Aerts, Acting Registrar and CEO of the BC College of Nurses and Midwives. So we are going to hear perspectives from these two regulators. Each have their own history and experience of the amalgamation. And as many of you will already be aware, many jurisdictions are moving towards amalgamations of regulatory bodies for certain professions. And so this should be a really good conversation. So please forgive my notes. And I'm going to start right off here, just to identify some of the contexts and drivers behind the amalgamation. So we know that some of us are already facing amalgamation or even considerations by the government of amalgamation. And I'm interested to explore what the drivers of the amalgamation might be. And, kind of what was the context and the purpose behind the amalgamation in your cases. So, Louise, maybe I'll let you start with that.
So great. Yeah, thank you so much. Again, I'm Louise, and I'm with the BC College of Nurses and Midwives, but I was the CEO and registrar at the College of Midwives prior to amalgamation. And for some context, the College of Midwives was a small college. We had less than 500 registrants. I had 6 staff total doing the work of regulating my 500 registrants. And in BC at the time, there were some reviews underway. The nursing professions, there was 3 regulatory nursing colleges, and they were going through a process of amalgamating. And so as the CEO registrar, I sort of saw the writing on the wall of where I thought we were going. Another piece is we had been receiving a little bit of government funding that had been slowly decreasing over time because we were so small and were fairly newly regulated. And that was ending. And so I was being faced with the registrants having to pay for it all on their own, and the fees were getting really, really high. And so I went to the board and said, here's the context. Here's what we're seeing. We're not being forced to do this right now, but do we want to talk about what we want it to look like? If we were being forced, what would we want the end point to be? And do we want to get ahead of it and maybe think about creating our own future? And so we had some really great discussions. We had to get really curious. We had to really think about not being stuck in the little box that we were in. And we really talked about alignment. We saw alignment with both the College of Physicians and Surgeons, as well as with the College of Nursing Professionals. Midwives are autonomous care providers. They're fee-for-service, very much matching a physician, but also very much matching like a nurse practitioner in that sense. And nurse practitioners were regulated by the nurses, a small regulatory group. So we saw a lot of alignment. Mm-hmm. Ultimately, it was a values-based decision. We really aligned most. I think all of us were regulating in the public interest. So the mandate piece was met no matter where we went. But we found a values alignment with the nurses. Also, they had been through it. So they kind of knew how to go through an amalgamation, and that was very attractive to someone who hadn't been through it yet. So that was our context that led to our decision to amalgamate with the nurses.
That sounds really fantastic. And the fact that you actually speak to values alignment and the importance of that, because bringing together a number of organizations, the organizational mandate is the same, but if their organizational culture isn't aligned, that can create massive challenges for you. Thank you. Dianne, what are your thoughts?
Yeah, thanks so much. So I'm Dianne Millette, Registrar of the College of Health and Care Professionals, and we regulate 9 professions that amalgamated 7 legacy colleges in June of 2024. Our context is a little bit different. Louise talked about the fact that their amalgamations, both nursing and with midwives, was voluntary. Ours was not. It was a mandatory amalgamation. That was driven very much by conversations that go back to 2017-18. So I guess the starting point was a review that was done of one of the health regulatory colleges in British Columbia that led to a lot of conversations about modernizing regulation. As part of that review, there were a number of recommendations, one of which was to consolidate the number of health regulators in British Columbia. That led to a steering committee report, made a series of recommendations, one of which, interestingly, was that perhaps an amalgamation of 11 professions would be a starting point, so a reduction to 5 regulators from what we had. At the end of the day, the minister made a decision to divide those 11 professions into 2 amalgamated groups, ours being one, regulating these 9 professions. So we started from a similar point in terms of understanding what the landscape started to look like in BC, but the end result was quite different in terms of voluntary versus mandatory, and then what aligns with
where
some
you
of that.
landed. Yeah, for sure. So knowing that this is a really big undertaking to merge all these regulators together, from a very practical and operational perspective, what has been the benefit or the opportunity that, or the gain that you made in this amalgamation? So maybe I'll start with Dianne.
Okay, sure, thanks. So we're still very young in our journey. I would say we're a nascent amalgamated entity. We're about 16 months into amalgamation. So, there has been a tremendous amount of work to get to the point we're at now. I think we haven't yet seen a lot of the potential benefits of amalgamation, but we are starting to see the benefits of things like being able to harmonize some aspects of our regulatory programs. And I'm sure Louise will speak to that as well. So one example for us is quality assurance. We have a project to look at harmonizing our quality assurance program. So it's impractical to run 9 different programs. So I think from an organizational perspective, that's one advantage. And I think also in terms of having similar requirements across professions for things like continuing competence or quality assurance makes some sense. So that's one of the benefits. The ministry certainly articulated some of their desired outcomes of amalgamation, which was being more efficient and more effective. And I think that we still have a lot of work to do to prove whether or not that is an outcome that we can achieve. I do think that part of the rationale was smaller colleges that didn't have a lot of resources might be better resourced in a larger entity. I think a lot of the smaller colleges did amazing regulatory work.
With very little.
With very few resources. So again, I think we do have a great pool of resources, but multidisciplinary regulation is expensive.
Absolutely.
And so I think we're yet to see whether or not some of those outcomes will be realized.
Thank you.
Yeah, and I would say, just building on that, we are 5 years in to the amalgamation. So we amalgamated in 2020, the first nursing amalgamation in 2018, and then with the midwives in 2020. So we've had a chance to see a little bit more of the benefits. I think one of those, and I just want to say thank you, Dianne, because I like to think we were regulating really well as a tiny college and really ensuring public safety. And we were probably 2 disciplinary hearings from disaster. In terms of just the financial aspect of it. So one of the big things is just the economies of scale that you get moving into a larger organization. For our registrants, it was a reduction in fee from over $2,500 per year to about $700 per year. So that was significant.
It's a big difference.
And we grew. And it's interesting now because when I sit at the national midwifery tables, I can sometimes upset my colleagues because I say things like, oh, our librarian could do that. And they're like, you have a librarian? And it's like, I'm trying to be collaborative. I'm not trying to, be bragging or something. But at the same time, it's not the same as what they have. It created opportunities. We have, it's humbling in some places. We have PhD prepared people all throughout the organization who are just absolutely experts in their piece around policy or around quality assurance or around whatever it might be. And so I really do see those kinds of benefits that we just didn't have access to as a small college.
For sure. Were there any hurdles that you think were really substantial that were difficult to overcome?
Maybe I'll jump in to start. One is it doesn't happen overnight. You can be amalgamated, but it doesn't mean you've harmonized all of your processes, policies, standards. And in fact, if you don't prioritize that, it could go on for a long time without those kinds of efficiencies. So you do really have to be really focused and determined for that outcome in order for it to happen. one of the things I've noticed two things I would share. One is agility. As a small college, I was super agile.
Yeah.
I could turn around a policy in no time flat if need be. In a larger organization, we have a lot more frameworks, we have a lot more process, we have a lot more. Do I think we have a more robust policy at the end? Yes, it's more defensible, it's more all those things, but it takes a lot longer.
It takes time, yeah.
And then the second thing I would say was registrant engagement.
Yeah.
With 500 registrants, I could be accessible to anyone.
Yeah.
And they were very engaged with us. If I did a survey, I would get a 70% response rate.
Yeah.
And that doesn't happen when you have 77,000
For sure.
registrants.
Yeah, absolutely. So, go ahead.
Yeah. So I think from my perspective, one of the challenges is that these initiatives are massive change management initiatives.
Yeah. Yeah.
And, there's a real need to be intentional about your change management strategies as you're going through this,
agree.
not only as Louise spoke to in terms of engaging registrants, but also staff that have no control over some of what's happening within the organization, and from a registrant perspective to them as members of a profession that have their own professional identities and have had their own legacies.
Yeah.
So I think we can't underestimate the importance of thinking about this as a change management initiative.
Yeah.
For us, some of the other challenges were definitely on the operational side. So we'll call it the back office sort of functions, where many of the smaller colleges contracted out resources, finance, for example, HR, IT. We didn't have the infrastructure.
Yeah.
And so we started off on June 28th, 2024, without having a lot of that infrastructure in place. And so that has taken a lot of time to build. And fortunately, we're in a great place now, but that's another significant challenge if you haven't been able to prepare for that.
Yeah.
And I think the other registrant challenge is that there were definitely professions and members of professions that didn't support amalgamation, and probably still don't support the notion of amalgamation. So again, it kind of speaks to change management, but it also speaks to just legacy, lived experiences, and how people see their professional identity caught up in regulation, even though it really shouldn't be.
And my sense is they feel a loss of independence when they become part of an amalgamated body. So I can appreciate that's a challenge. I'm just going to close with asking you one question in terms of the interest holders. So the patients, the public, any feedback? Have you received any feedback on changes that you've made, or are they even aware of it? Is it pretty seamless for them?
Sure, I can start. I would say for the public, it's very seamless.
Okay.
In fact, for the registrants as well, I would definitely echo their professional identity gets confused in this. And so part of that change management is really helping them to understand their professional identity isn't tied up in regulation. In fact, what changed for them is the name of the college at the top of their regs. That was the only thing that changed in that process.
Excellent.
They're registering the same, they're whatever. For the public, I mean, I think all regulators, we have an issue with the public even knowing we exist and what we do.
True enough.
I don't know that changed in any way with this.
Yeah, I would agree with that. And I don't know that we've done or we've had opportunities to really canvas that.
Yeah.
So
You're
it's
still
not
pretty early.
We are
in the
quite
game.
nascent in this journey.
Yeah.
I will say that in terms of other interest holders like professional associations, we have done a lot of work to actually try and build our relationship as a new college with those associations that would have had historical relationships with their legacy colleges. And that takes time and effort and a willingness to collaborate and be collaborative in this new world of amalgamation. And same for national organizations. That's one of the other challenges for us is many of these professions have national alliances or federations, and figuring out how we fit in their context and vice versa is another piece that we still need to figure out with interested parties.
Well, thank you. Thank you so much to both of you. We'll be watching your progress because Saskatchewan is close behind. So selfishly, I will be watching your progress. So thank you very much. And thank you to our viewers for tuning in.